Steve at 10 in the morning now, 8:13 here on a Wednesday morning, and time for Wednesdays with Wagle. Dr. Jason Wagle with Kansas Perio and Dental Implants with us this morning. Good morning, Dr. Wagle.
Good morning, Steve.
There was a news headline last week, drowning in a sea of salt. What's your take on that story?
It's very interesting. Americans on average consume about 3,400 milligrams of salt per day. To put that in perspective, 1 teaspoon of salt is approximately 2,100 milligrams.
What can people do to reduce their salt intake then?
Number one, I would say think twice before reaching for the salt shaker at mealtime.
Well, what about foods that are already high in sodium?
That's a key point, really. The FDA is asking the food industry to reduce sodium levels in processed and prepared foods. Many people don't realize that foods such as bread rolls and chicken breasts are very high in sodium already. And just one serving of certain salad dressings can provide a large percentage of your total daily sodium allowance.
What are the health benefits of reducing salt intake?
The American Heart Association says that reducing sodium to just over 1 teaspoon a day could prevent an estimated 450,000 cases of cardiovascular disease over a 20-year period.
And what about the effect of too much salt on dental health?
Salt in itself is not directly bad for the teeth and oral health. However, it may have some indirect negative effects. For example, too much salt can contribute to mouth dryness, which can lead to an increased plaque, tooth decay, gum disease, and yeast infections in the mouth.
Any other issues?
Yes, too much salt in the diet can also deplete calcium stores in the body. Calcium is important for bone and tooth health and remineralization. Loss of calcium can be an aggravating factor for gum recession and bone loss. The result could be greater susceptibility to advanced periodontal disease, tooth decay, and increased chances for tooth loss.
So what's your overall message regarding dental health and nutrition?
At Kansas Perio, we emphasize that a healthy, well-balanced diet with careful monitoring of salt intake is recommended for good overall health and dental health.
Thank you, Dr. Wagle. Wednesdays with Wagle, sponsored by Kansas Perio and Dental Implants. When it's time to get serious about your smile, go to kansasperio.com. The phone number 685-2731.